Read a smile behind my mask. How long will it last? Stimulus going fast. Government won't act. How long will this be going on?
Aloha, this is Skye, your soulful progressive with FNN-Feminist News Network, that feminist news that's right for you. Welcome to Skye in Kaimoki, Hawaii, in Honolulu, giving you that soulful news you need. Yes, indeed. And if you haven't liked or subscribed and got that soulful news, that soulful way, well, baby, you better let them know they can get it today. That's right. All you have to do is click on the link below that says Feminist News Network. Watch more videos. See what I'm predicting and laying down, doing it 100 progressively. Yes, indeed. Now, what is it I want to talk to you about today? What is going on in progressive news? It seems like the opioid deaths of African Americans are growing greater during the pandemic and other drug deaths. And why is this? Let me tell you why. It's real simple. The black communities do not have rehab centers that they need, where in more privileged, outlying, better communities get everything they want. Now, here in Hawaii, if you own a lower class of insurance, you can only get 14 days in rehab. Now, how do you get cured off of 14 days over at the, what is it, Salvation Army rehab? That's what the low income, because if you can get the nice, you can go off to Lanai or Maui and be in a nice rest home with facilities and near the beach and fresh fruits and vegetables and good things to eat. You can't get that. And most definitely not in the U.S. black neighborhoods that have black and brown being suffered the most during this COVID, by being affected the most by this COVID, dying the most of this COVID. We need help, and we're not getting it. Now, there was an article in NPR that discussed this and brought it out to the forefront, and I'm glad that they have. So let's take a listen. I'm going to read you part of this article, and then we're going to discuss. According to Jenkins, her mother tried to get help. She asked, can I get the rehab? I have a drug problem. They said no rehab wasn't an option for her. In December, Hoogley, who was 48 years old, used methamphetamines contaminated with the deadly synthetic opioid fentanyl. We got a phone call from my mom's boyfriend that said that he found her dead, Jenkins said. Scientists at the Centers for Disease Control and Prevention say fatal overdoses nationwide have surged roughly during the pandemic, killing more than 83,000 people in 2020. While the CDC doesn't track overdose deaths by race, a growing body of research suggests black Americans have suffered the heaviest toll, a deadly collision of race, addiction, and COVID-19. It wasn't until we started looking at a new level of race ethnicity that we realized black and brown communities are being disproportionately affected, said Dr. Yusha Karte, a researcher at the University of Pennsylvania. Karte's team analyzed drug overdose data collected in Philadelphia during the pandemic. They found overdose deaths surged more than 50% among the city's black residents. And among whites, by contrast, overdose fatalities remain flat and in some months even decline. COVID really just acted as
salt in the wounds of health and social inequalities perpetrated by structural racism, both in Philadelphia and across the country. Her findings were published in January's peer-reviewed study in JAMA. This added to the growing sense of alarm among the researchers and health officials. The COVID-19 pandemic has sharply exacerbated the inequalities of the overdose crisis, which is really, really scary. Dr. Onion Jordan, a researcher at Yale University. Now let's talk.
I know you heard that. See, it's serious. You need more than one or two spotted out into the community and be lucky enough to be that black community that does have a rehab center. There should be something added into this pandemic for the racial diversities and degradation that's going on to try to lift these communities that are black, of color, Hispanic, brown, Asian, that are suffering during the pandemic, and indigenous that are suffering during the pandemic, to give them rehab facilities, to give them monies for this, to help them. Because all that keeps ringing in my head with a $768 trillion defense budget, and you're talking about cutting down the qualifications to get this $1,400 stimulus check that should have been $2,000 in the first place, by lowering the family income and the income of those that get it. That's cutting off 5 million people and about 12 million children. That's nastiness and ugliness in the highest form. Now, it's only going to get worse out here. So we got to let our legislation and demand what is needed. And what is needed is more money for these communities so they can deal with the rehab. Now, what they need is more monies within the stimulus to immediately address this issue, to help those communities that those that are privileged depend on for their day-to-day. Now, Wanda Sykes said it best, and I'm going to end it with this. But remember, in this era of hate, you're going to have to participate, because if you don't, this type of neglect will happen in every brown and black space. In every black and brown space. Now, leave your comments below. Let me know at FeministNewsN at gmail.com. Don't forget to like and subscribe to the YouTube channel and the Facebook page. And I'm that Soulful Progress one on Twitter. Got that rant of the day on Blogger. And I'm no longer that one-woman team. So thanks for joining. I appreciate all you joining the news crew. Peace. If you care to donate, that's Venmo at Skye Soulful Progressive. Thank you and mahalo in advance. Every bit is appreciated.
See the smile behind my mask. How long will it last? Stimulus going fast. Government won't act. How long will this be going on? I'm standing here in line.